Assalamu alaikum. I'm Sumbal Arif from King Edward Medical University, Mayo Hospital, Lahore, and today we will discuss about coronavirus, COVID-19. Look at this picture. This is the viral picture of this year 2020. And now we are all familiar with this. That is coronavirus. It's a microscopic structure of a group of RNA viruses. That is coronavirus. And its size is almost about 20 nanometers. How small it is. And just look at its effects. Contents. In this topic, we will discuss about introduction of coronavirus, its symptoms, what are its risk factors, and what are its preventive measures. So let's start with its introduction. What is coronavirus? Coronaviruses are a large family of the viruses which may cause illness in animals or in humans both. This virus is known as COVID-19. It is the most recently discovered virus and it was unknown before its outbreak. It began in the Wuhan, a city of China, in December 2019. In this picture you can see how it can get transmitted and the overview of signs and symptoms. You can see that it transmits from human to human. Coronaviruses are the most commonly spread from an infected person, either by coughing or sneezing, personal contacts, touching, shaking hands, and even if they touch the objects or any other surfaces, and if the healthy person touches that surface and eats with that hands, then he can get infected, and also fecal contamination. And the common signs of the coronavirus infection are the fever, cough, shortness of breath, and gastrointestinal problems also. And in severe cases, it can become pneumonia, severe acute respiratory syndrome, kidney failure, and also can cause death. Let's discuss in detail about its symptoms. The first symptom the patient can show is tiredness. वो थकावट महसूस करेगा. Symptom he can show is dry cough. खुश्क खांसी होगी उसको. And he may have fever. He may also feel pain in his muscles and joints. And he may also feel that there is a blockage of the nasal passage. He may show the symptom of a runny nose. It means that it shows that there is inflammation and swelling at the inner linings of his nasal passages and sinuses. And the other symptom he can show is sore throat. Here you can see the healthy throat and a sore throat. You can see the main difference. That is inflamed tonsils. He may also have diarrhea. At start, these all symptoms are usually mild, and then they get worsened with the time. And do you know that all patients are not showing the same symptoms at all? Some people becomes infected but don't develop any symptoms at all, and they don't feel unwell. And about 80% recover without any special treatment. But around 1 out of every 6 people who gets coronavirus, they become seriously ill and they feel difficulty in their breathing. And who are the people who are at more risk? कौन से ऐसे लोग हैं जो ज़्यादा रिस्क पे हैं? As this is global pandemic, older patients with a high BP and any other heart problems, and diabetic patients, they should care more and should stay at home and wash their hands regularly and after every 20 seconds. Nowadays, Why we are advised to stay at home and stay away from people? Because this is the disease that can spread from person to person through small droplets from their nose or mouth while they are sneezing or coughing. And the other people's, they can catch this COVID-19 even by touching those objects that touched before by the unhealthy patients. People can also catch this coronavirus if they breathe in droplets from a person with coronavirus patient who coughs out or exhales that droplets. How can we prevent ourselves from this virus? इस खतरनाक वायरस से हम अपने आप को कैसे महफूज रख सकते हैं? सबसे पहले, stay aware, stay updated with the latest information. And you can get this information through the social medias or TV and any other channels and through your national and local public health authorities. Second preventive measure you can take is wash your hands. It is the best preventive measure. Wash your hands regularly and thoroughly. Clean your hands with an alcohol-based hand rub and wash them with soap or water. Use hand sanitizers. They are short in market, but you can also make in your homes. Wash your hands before touching any part of your body, face, mouth, and eyes. Proper hand washing techniques or steps are: turn on clean running water, then lather up with soap, scrub for at least 20 seconds. And remember to scrub between your fingers, under nails, and up to wrists. Rinse the soap completely off in clean running water. And at last, dry your hands completely. Completely dry your hands, it is the most important. Also protect others from getting sick. How? You can cover your mouth and nose with your flexed elbow. If you don't have tissue paper at that time, while you're coughing or sneezing, you can cover your mouth and nose with your flexed elbow. And throw that tissue paper in the closed dustbin immediately and then wash your hands. And again, maintain the distance at least 1 meter, that is 3 feet, between yourself and anyone who is coughing or sneezing. Nowadays, stay at home. Please stay at home. Do not go out unnecessarily. Stay at home until the local health authorities allows us. And avoid traveling to the places, especially if you are an older person or have diabetes, any heart disease or any other lung disease, because they are at more risk. And the most important, avoid gatherings. Avoid meetings with your relatives, friends, and avoid going here and there rushy areas. And eat the food that can boost your immune system. Because a good immune system improves cardiovascular health. It lowers the blood pressure. It helps in control body weight and protect against a variety of diseases. Here you can see the top 10 immune boosting foods. It includes citrus fruits, vegetables, turmeric, pineapple, ginger, pumpkin seeds, berries, yogurt, vegetables, green vegetables, and garlic. Up to now, alas, there is no such vaccine that can prevent this coronavirus. However, those that are affected should receive care to relieve the symptoms, the common symptoms like flu, cough, and fever. People with serious illness should be hospitalized first. Mostly patients recover. The possible vaccines and some specific drug treatments are under investigation. The World Health Organization trying their best to discover vaccine for this virus. The only best solution from this viral pandemic is prevention. Prevention is better than cure. इसीलिए जो slides आपको दिखाई गई हैं, जिसमें preventive measures दिखाए गए हैं, उनको please follow करें. Here is the most saddest picture for the Muslim Ummah. May Allah Almighty show mercy on us and allow us to perform Hajj. Ask for forgiveness from Allah Almighty, please. This worst virus has killed a lot of people, and if you are still alive today, use few seconds and thanks Allah Almighty for the gift of healthy life. Thank you so much for watching.